Travel nursing can bring you to places you've never been before. Tell us your story.
Good morning. I'm back again. I started and I had to stop, so I am back. Should have been here at 10. It's a little after 10 now. And explain the hat here is that I had to go out this morning early and it was cold. And so I bundled up. And so I decided instead of hat hair, I just leave the hat on. So there you go. Welcome to the Travel Nurse channel. We're here every Tuesday live. We are archived. Many videos over the last couple of years are archived on Facebook, and we're also on YouTube. And if you want to comment, please do. Let me open up that comment board. And if you ever want to join me, I welcome you. It's your story. Travel Nurse channel is about all things travel, nurse travel, doctor travel, all the disciplines, CNAs, LVNs, nurse practitioners, advanced practice nurses, respiratory therapists, radiation technologists, lab people, everybody, doctors, physicians, ER docs, many disciplines are traveling, healthcare disciplines. And so we want to be kind of a home away from home. I try to discuss things that are important to you. We talk about rates. We talk about how to become a traveler. We talk about steps to take. And then we talk about, you know, sort of holistic things. And so today's title, maybe you can see it. Yeah, how are you doing really? Today's discussion is that we are still dealing with this terrible pandemic. It's not going to go away. It's mutating. And our local hospital, I'm in Southern California. By the way, Pacific Standard Time, tune in on Tuesdays at 10. I apologize for being a little late today. I always prepare hours ahead of time, get the computer ready, and inevitably I have a glitch. So I apologize. I am not techno-savvy. I don't see the problems before they arise, so I deal with them when they arise, and sometimes that upsets the schedule. I'm so sorry. But we're here now. That's the good news. And what was I saying? We want to be a conduit for people that travel. We're here every Tuesday at 10 a.m. for about an hour from 10 to 11, and that is Pacific Standard Time. So it will be archived. You can watch it whenever it's convenient. And but if you want to be live, if you want to join me live, that's something we can do readily. I can stream several people on this, just like a Zoom, or I can do one-on-one. I've done that in the past. But, oh, hi, Gollum. Good to see you as well. But it's often just me lately, and I just have to do something about that. So you can, you know, I can hear what you really want to talk about. I mean, we talk about rates and jobs and applications and what works best and so forth. But today I thought I'd talk about the real you and what's happening out there. I'm in Southern California, as I said, and one of our local, we call it a district hospital, kind of like a public hospital. I'm surrounded by many hospitals, university hospitals and private hospitals and you know, sort of religious-based hospitals. I'm not too far from Loma Linda University and some of their branches. We have hospitals that are Adventist. We have hospitals that are Jewish, hospitals that are Christian, Presbyterian, you name it. We have many hospitals. But one of the closest ones to me is a district hospital, and their clientele, they are 90% COVID patients. So that, if you're traveling and you wind up in that situation, possibly in California, possibly in New York, possibly in Florida, I mean, there are a lot of places where COVID is still a treacherous disease and a devastating disease. And, you know, we couldn't be in this field if we didn't have tools and practices that help others. Are we curing it? Not necessarily. It is a virus. What do you think of the vaccine? Did you get it yet? Oh, I might be getting it today. I think so. You know, let me say this. Let me put this caveat out here. I've said it different times during my broadcast. I'm giving you my opinions. I've been a nurse since 1977, since before many of you were alive. But I've been a nurse, registered RN nurse since 1977. Yeah, because I took my boards. I believe it was we sat for 2 days back in the day, and I believe it was 7/6/77 and 7/7/77, 1977. And so that was easy for me to remember because I'm not really a numbers person. At any rate, during my nursing courses and my clinicals, they encouraged us that winter to get vaccinated. And I did. And I often do, particularly now. I'm a senior citizen, and I have had respiratory problems, and I have had the flu. I have not had the COVID-19. I hope I don't have to have that. But at any rate, it was encouraged for us to get vaccinated, and I learned a lot from that, because I want to say maybe only 20 or 25% of my fellow colleagues and collegiates and student nurses did get it. But I was one of them. And I make that decision to do that. And I will get the COVID-19 vaccine. I am not on staff anywhere, so it hasn't been offered to me, but I am a licensed carrying RN, and I could potentially volunteer to give the vaccination to others once I get vaccinated. So I've been waiting for my provider, which is connected to the university hospital. They asked us to not tie up the lines, that they would contact us when the vaccine was ready for us. That hasn't happened yet. And actually, I called for another appointment that I'm due to get. I can't remember what it is, but I'm due for it. It's not a mammogram. I think it might be a bone density or something. You know, I'm an old gal. Anyway, so I called for that appointment, and I haven't heard back from that either. So I imagine they're impacted, and that's fine. But I think I can, there's someplace else I can go, to another campus and another university. And I do believe there's a couple of places where you can sign up and maybe wait online and get vaccinated. I think it's important that I get vaccinated. Thanks for asking that question. What do I think of the vaccine? I'm not afraid of vaccines. There really hasn't been a lot of bad news about the vaccines. There's always conspiracy theories, and there's always more to the story. So for the most part, I've done vaccination clinics for others, and not COVID, but usually the worst thing that happens is somebody faints or they get a sore arm. The Tdap, the tetanus and diphtheria, that one, the polio one. What is it, DPT? Tetanus, diphtheria, and polio, I believe. Anyway, pertussis. No, not polio, pertussis. That one hurts. Your arm feels sore from that one. But generally, no, with good technique, and if you can, if the patient, the receiver of the vaccine can be fairly relaxed, generally there's almost no side effects from the vaccines. If you have egg allergies or some other conditions that we check for before giving a vaccine, maybe the vaccine's not for you. But for the general public, for most people, from very young to very old, vaccines are a good idea, because even if it doesn't mean 100% prevention, it means that if you contract something, that you will have a little bit of fighting power, that you'll have a little bit more resistance, and hopefully you will not not have as serious a condition with that particular virus or flu or whatever. That remains to be seen with the COVID. But I will tell you, most of my colleagues and friends and acquaintances that are working in the hospitals, which are mostly nurses and doctors and techs, some techs, have been vaccinated, are doing fine, and have not gotten sick, have not gotten COVID. So they practice safely. They adhere to even more rigid isolation practices for themselves and for their patients than ever before, and they are doing very, very well. What they're not doing, and why I asked the question is, how are you doing really, is how are they doing holistically? How are they managing the extra workload, the devastating results, where I really can't stand looking at my old chair that needs to be, I don't know, what is that? It needs to be re-knitted or whatever. I don't know. I've had that chair for a long time. I actually covered it, that green fabric. I covered it years ago, but I never got to the meshing and the wood and so forth. So that chair has to go. It has to go. All right, folks, back to the program. How are you doing? So here's my concern about many of you, whether you're working in a long-term facility, an acute facility, in a clinic setting, if you're about to travel or if you're on a travel assignment, and for example, our little local district hospital, 90% COVID patients, and a huge percentage of those do not have great outcomes. How do you deal with that? Take a drink of water. I really don't know. I really don't know, because I'm not in that situation, but my friends are, my colleagues are, many, many of you are. Oh, my friend Sharon, hi. Hi, Sharon. Sharon's been involved in the healthcare industry for many, many years as well, and did a lot of scheduling and staffing and managing of nurses, and she's the bomb. Sharon, get a vaccine as soon as you can. She's quite a bit younger than me, but yeah, I think the vaccine is a prudent way to go, and I will get it maybe as soon as today. I'm headed over to a place I know that is providing it. Excuse me, itchy nose. So sorry. Oh, where's my sanitizer? Okay, so the vaccine that's being provided right now, I believe, is a Pfizer one. There are a couple of other vaccines out there. I'm not sure that we have them yet in California or my neck of the woods of California. So this one, the Pfizer one, is 2. You have to get a first shot, and then 2 or 3 weeks later you get another booster, and then you are considered vaccinated against COVID. Oh, I'm so glad. So Sharon is saying that her parents received the vaccine. That's great. They're more my colleagues, my age group. That's great. So glad for them. Yeah, I've got to get on. I didn't push it because I'm not active clinically, but on the other hand, my mom is a senior. I'm around my infant granddaughter, and I do some volunteer work. So I think that I can call my RN card to order here and let them know I have not been vaccinated and I need to get with it, and so I can, provide safe, even if it's at a volunteer level, safe care to others. So hopefully I'll be getting it. But how are my colleagues that are doing it, that have worked through all of this, that the travelers that have gone on assignment to places that have been very, very much impacted by the pandemic? I don't think, oh gosh, what does it mean when your nose is itchy? It's not really itchy. It feels like I'm going to sneeze, so there you go. That's what it means, that you're going to sneeze. It means you're going to get in a fight. When your nose is itchy. When your palm is itchy, it means you're coming into money. All these wives' tales. All right. The people that I talk to, the nurses, the doctors, the respiratory therapists, they are very much, and many of my friends are still in the acute setting. There are some that are doing home care, some that do, there's so many jobs available to nurses and so many travel jobs, actually. It's yeah. COVID clean. COVID clean. Yeah, we want to be COVID clean, but it's difficult to do so. So, so my friends, my healthcare friends, the nurses and doctors and therapists that are working with the patients, the people I know most closely are mostly in acute settings, but there are people in clinics and doctors' offices and long-term facilities and LTACs and so forth that are impacted as well because the patients are very sick. And because of the pandemic, in most areas, you don't have family members there with you. You're dependent on FaceTime, you know, a little picture on a phone, and texting. I mean, you know, you can't hug someone on a phone. You can't cry with them. You can't laugh with them. I mean, you can. I mean, it's the second best choice, but it's frustrating. It's frustrating. And so the people at the bedside are doing what they can. Oh, that chair is just irritating me. Get my ugly chair out of my vision. Sorry about that. It's just distracting me. I actually had brought that into the hallway to bring it down, and it never happened. Okay, so Gollum is with us, and Sharon is with us, and it's so great to have you both here. Anybody that wants to call in, you could come on live right now. Our number is 800-737-6518, 800-737-6518, and you could stream with me and we could talk more about this. But those that are working through this pandemic, those that are traveling in 2021, those that are working are often being asked to work more. So here's some of the conditions at this hospital where my friends are. That is 90% COVID patients and short-staffed. So they're ICU nurses. Now I'm talking critically ill patients, most of them on ventilators, most of them with multiple disease processes and illnesses occurring simultaneously, putting them there in that ICU, or in the ICU where it should be 1-to-1 because of the critical needs and you know, the heart conditions and the post-ops and all of these things that put them in the ICU are now 3-to-1. So now, in addition to all the concerns you have for your patient, you're stretched where you have to take care of 3 patients, and I'm here to tell you, something's going to get missed. Somebody is not going to get what they need, and you included, because of that frustration and that concern and that additional anxiety. That's one piece of it. The second piece of it, same thing with the therapist. Therapists normally take care of what? 2 vents? Well, somebody can't make it, or somebody gets called off. What was the situation the other day? The therapist's child, the nanny, was bit by the family dog and had to go seek care, and so the therapist had to leave, and that put them short. So now you have a variety of respiratory therapists taking care of yet another vent or another BiPAP or another COVID patient. And those of you that are in the thick of it and know what's going on You understand. People need to be prone, whether they're on a respirator or on a BiPAP, on the rebreathe machine, the air, what is it? The airvo, all these mechanisms to get them oxygenated. That is just one of the things with the COVID-19 virus is that people have difficulty breathing. People have difficulty maintaining oxygen levels, and they're very, very tired. Well, everything's tired, right? So you need muscles to breathe, and so all of these things come into play. And what's happening is that the staff, the nurses, the therapists, the doctors, the LVNs, the NAs, the RNs, all of these people are called to actually provide even more physical help because they have to prone that. Do you know some of these patients are prone for 18 hours with all this machinery and breathing apparatus and medicines? You know, many of the patients are their platelets are low, or their sugar is high, or their clotting times are off. I mean, there are so many issues, and we're human. And how does that affect you? And how does that affect you on the job and off the job? I'm not asking because I'm not asking just to be nice. I'm asking also because it's a concern, and I want you to be able to handle those questions and care for yourself. Because if you don't care for yourself, you can't really provide the best care for others, right? So that's what I thought we should talk about. I think that you need to recognize when you're on the job if your stress level is just getting a little out of control. If you're physically exhausted and you've been working for 5.5 hours straight and you don't get a break, what do you do? If you are feeling emotional because someone you know is sick, and you feel like, why am I not with Uncle Rick? And why am I here with, Jane Doe? Patients you don't know, you don't have an emotional attachment, a physical, a relative, you're not related to them, and you're caring for them, and you know that you would rather be caring for Uncle Rick. So all of these things work at you, eat at you, and mentally exhaust you, and the physical exhaustion added to that. And then you have your leadership going, we're short, can you stay longer? Or we are down 2 on Thursday, and today's Tuesday. Can you come back on Thursday, even though that was your scheduled day off? So there's all these things that you're dealing with, and how are you doing with them? How are you doing with them? Do you know what to do with them? Do you have a plan going forward? These are the things that are on my mind, and there are solutions. When you're stressed out is not when you my glasses are always crooked. Ugh. My ears are crooked. When you're stressed is not when you're able to come up with solutions, but when you have some time to think, when you can hear the quiet, you can think. There are solutions. And so I guess that's what I want to encourage everybody to do, is to really care for yourself, to really evaluate how you are doing, short-term, long-term, at the moment, in the situation, in the ER, in the ICU, in the med-surg unit, with your long-term patients, with your senior patients, with your pediatric patients. How are you doing? How are you doing? That's the question to ask. And if there's a predominant feeling of anxiety, anger, anything sad or bad is going to weigh you down. GLAD works. Glad actually lifts you up, right? But sad and bad, angry and mad, those pull you down and wear you out. So, yeah, that's what I've been thinking about. So, my opinion is that if you are there, if you are, have been doing 12-hour shift after 12-hour shift and adding one a week, and traveling and hearing about people at home that are sick, like Uncle Rick, I just made that up. It could be Aunt Sissy or, Uncle John or my cousin or my brother. It could be, right? So, so you need to take a deep breath. You need to take some time and find out what your solutions are. And if you're traveling, that's a strong commitment. And with all these situations of short-staffed and not the healthiest ratio of nurse to patient and so forth, it's not a time to pull back, but to reevaluate. So you talk to your recruiter, you talk to your charge people, your people in charge of your unit, whoever your supervisor is, your immediate supervisor. You maybe really back off of doing any overtime. Here's the thing. What you want to do and what you're able to do are two different things. And so I often say that when, in my many years of counseling and managing staff, of what are you able to do and what are you unable to do? What do you know and what do you need to know? Those are questions you have to ask yourself. So if somebody, you're on a travel assignment and you're contracted to do X amount of work in 13 weeks and you do your very best to do that, but they schedule you 4 days in a row. And in the contract, it said that you would do 3 a week, 3 12-hour shifts a week. And just the way the schedule panned out, you're doing like 4 in a row. And you're very, very exhausted. You've been working in an ICU. You've had mostly COVID patients. You've been a little understaffed. You've been a little extra stressed. That's the time to go talk to your supervisor and just say, look, I really want to come back for that 4th shift, but I just don't feel fit. I don't feel capable. I'm still reviewing everything I've done in the last 3 shifts, and I'm still, uncomfortable because I've had 2 and 3 patients every day, and I'm physically exhausted. I don't get a chance to stretch or, get any cardio. It's cold outside, and I haven't been able to take my hikes and my bikes and my things that I do to stay healthy out of nutritious food. My family's far away. My uncle is sick. Please don't make me work 4 in a row. Is there anything we can do about this? Because I'm just afraid I'm reaching the end of my tether and I won't be your strongest, I won't be the strongest nurse I can be when I come back, or the strongest therapist I can be, or doctor I can be on that 4th shift. Is there anything we can do? Or can I just come in for a couple of hours rather than the whole 12? Is there something we can do? Please work with me, because I want to provide the best care I can every time I arrive to take care of a patient. And I'm just realizing, partway through today, day 3 of a 12-hour shift, that I am really spent. I am really stressed, and I don't know what to do with it. I don't want to get angry inappropriately, but I just, I'm very concerned about coming back for a 4th day in a row. Is there anything at all that we can do and work together, And it's not that you don't want to help. You want to help. That's why you said whenever they asked you to do that 4th shift that you would. I'm sorry. I don't feel a sneeze now, but I feel itchy nose. I apologize. Okay, that's one situation. Another situation may be that you're fresh, you had a couple of days off, you're midway through your travel assignment, and they dump another patient on you. and you're managing absolutely fine. You have a couple of patients on bypass and that airflow thing, and lots and lots of oxygenated patients, and some are conscious, some are not. Most of them are very tired and very sick. And let's say you're on a tele unit and you have 6 patients, which is really more than you should have. Now your concern is, I'm fresh, I'm ready to go, and I'm strong, and I'm alert, and I know how to take care of my patients, but now they want to give me a 6th or 7th patient, and that is going to be unsafe. So you don't get mad. Oh, maybe you do get mad. They try to do that, but you get active. You take a breath, you find out who's in charge, you go speak to the person in charge. They don't call you back if they're not on the same unit with you. Maybe a lot of the charge people are managing more than one unit. You try a second time. If you don't get through to who you need to get through to, you go to the next level. So you go to maybe you've gone to the supervisor or the charge person, now you go to the manager. So you just go to somebody and say, I am very concerned about the safety of me taking this additional patient when I have, 1 on event, 2 on bypass, blah, 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 whatever the situation is. And have that conversation. Safety is a big concern. And, you have to bring in more help. I have nobody to do the baths. I have the respiratory therapist hasn't been around. I can't manage all of the respiratory equipment and, take care of the medical and surgical needs of my patients. So you talk to somebody in charge and share that responsibility and make it safe. So there are solutions. It's not easy and it's not pretty. And you have to seek those solutions. I know none of you are quitters, but I know you're only human too, and that this is tough stuff we're dealing with right now. I'm not dealing with so much as reviewing it and researching it and listening to my colleagues, but I know it's you're in the thick of it. You're all in the thick of it, and I have my concerns for you, and I just want to be able to support you in ways that I know can be effective in the workplace. Now, what about outside the workplace? So when you travel, do you travel with your family? Or when you travel to another state, is your family behind? And what does that mean? Does that mean children, loved ones, husbands, parents, pets? My pets, I love my pets. So do you travel with or without all of these people in your life? Some travel with, some travel without. Both are difficult. If you're traveling with and you start to get some of those feelings that are wearing you out, those angry, sad, mad, bad feelings, then you don't want to dump all of that on them. So maybe you're isolating a little bit, whether they're with you or far away from you, because you don't want to just blow all that anger out at them. It has nothing to do with them. It has to do with your frustration on the job and your physical exhaustion and your wearing away at your physical well-being. And maybe you're not sleeping well. Maybe you have too much of this on your mind, It's not pretty. It's not pretty. I don't even know if I should share this on the air, but I always check in with my really good friend who has been working through it and who also has some health issues, personal health issues. And she's been telling me about this patient that she was actually, it wasn't even her patient, but she saw her be admitted many, many months ago for COVID and recover and be discharged, which is a great outcome, you would think, you would hope, and come back and get very, very, very sick. And she helped with the turning because they do this proning thing and they do a lot of turning, and that her oxygen is so poor and her situation is so deteriorated that her lips are black. Her lips are necrotic. This poor woman and my poor friend. that's just in the region of caring for her to help with the turning. It's not even her patient, but the impact of seeing a human being that should have rosy lips have black lips, which means necrosis, which means so many things are breaking down and the oxygen is not what it should be. And who knows, there's diabetes involved and so forth. I have seen terrible things, cancer of the skin and the face and surgeries you wouldn't believe, but I haven't said I've ever looked at a face with black lips that are starting to just break away from the face. So all I could do was listen to her. I said, oh, that sounds terrible. I'm so sorry. What do you say to that? So tough stuff out there. I'm sorry. Maybe I shouldn't have gone that far. But that would be another thing. Talk to somebody. Travelers, I know that you don't want to get angry at anybody, but you need to talk to somebody. And here's a way to start that conversation with, maybe it is a loved one. Maybe you don't travel with your family and they're far away and they're looking forward to hearing from you, whether it's your mother, your sister, your brother, your husband. Just say, hi, I love you. Can I let you know how angry I am? Can I let you know how sad I am? It's not you, it's the situation. And so I think being afraid of erupting is understandable, but letting it out, like the steam on a pot. So it's all boiling, it's about to boil over. If you crack the lid on the pot a little bit, some of the steam can go, just get rid of a little steam. And then when you lift it, you're not going to get burnt because you were careful. You let a little steam out first. So that's another thing. Emotionally, you have to let off some of that steam before it erupts, before it bursts and hurts you and hurts others. And easier said than done. Come on, we all get upset and we all are not always appropriate all the time, but there are solutions. If you could take the time to ask yourself, how am I doing? Really, how am I doing? Okay, this is what happened when I started my shift, and this is what happened within an hour, and I wasn't even fully getting report, and they told me I'm getting an admit, and I already knew there was blood running, and I already knew I knew 4 out of my 5 patients had COVID, and it's a lot. It's a lot of responsibility. It's a lot of physical and emotional and mental activity, and it will exhaust you, and it is tough, and I'm thinking of you. And if you ever want to come blow some steam off on the Travel Nurse channel, you are welcome. You are welcome. And others would benefit, So call anytime, 800-737-6518, or you can email me anytime, Rita@travelnursechannel.com, Rita@travelnursechannel.com, and we could set something up if you want to be part of the broadcast, or if you just personally want to share something, and then I could share it in one of our videos, if you want that. Whatever you want. I'm sure you have much, much, much on your mind. You're amazing people. You always have been, but these are extraordinary times. And so get vaccinated. I have to, disclaimer, get vaccinated if you feel you should. I feel I should. And unfortunately, I haven't because I'm not on staff and I don't have a healthcare job at the moment other than this. And so I have to seek it on my own. I was waiting for my provider. I'm a senior, but my number hasn't come up yet. So I'm not going to wait any longer. I'm going to go out and seek it. One of the universities is providing. So I'm going to head over there soon, today, actually, and see if I can get my vaccinations going, because then I know I could volunteer and give vaccinations to others. And the sooner people are vaccinated, it's going to be a little bit of help in fighting this terrible, terrible virus that has affected our world. It just almost doesn't even seem real, does it? Even after a year. It's been almost a year. In March, we're in February. Happy February, everybody. In March, it'll be a year that we know of, right? So we were starting to hear a little scuttlebutt about it early in the year last year, but it was official in March. And I can't remember the date. It's 12th March, early March, right? Anyway, that's all I have to say about that. That's not really all I have to say about that. We're nearly out of time. So tune in. Travel Nurse Channel is here for you, for recruiters, for travelers, for people thinking about traveling, for healthcare workers, for nurses, primarily for nurses. A lot of RNs are traveling. A lot of LVNs are traveling. There's travel assignments for CNAs as well. But all of the healthcare disciplines, many, many, many opportunities for travelers. We've talked about that. There's over 300 travel companies in the United States. Imagine that. And I think I'm going to sign off. It's almost 11. I'm not hearing from anybody. It's Tuesday. You're probably all busy, working. I encourage you to take good care of yourself. Take as good a care of yourself as you do for others. And if you're not doing well, please seek solutions. Please talk to your supervisors, your recruiters, your managers, your loved ones, your friends, or counselors. Oh, I didn't even get to that. Many facilities do offer counseling, either on your days off or even when you get a break. I remember one of the places I was working as an agency nurse would do wonderful things, and I don't even think it had to do with Nurse Week, but they would set up a like a mobile massage center in the middle of the hospital. So you could just go sit on one of those wonderful massage chairs and just kind of put your arms up and relax, and somebody rub your back and shoulder. Oh my goodness. Somebody rub your head. I love a head rub. They also had quiet rooms. Some of the places where I worked, they'd have rooms where you could just go in, turn off the light, and be quiet with yourself. What a way to spend a 15-minute break. You know, most of us have phones. You could set your phone for 15 minutes, just chill, meditate, pray, whatever you need to do. Do nothing. Empty it all out. Most places, most facilities have chapels. That's another place to go and be quiet. Or just go out and get some fresh air. Or watch the Comedy Channel. Do whatever you need to do. And if they provide counseling, there's no shame in that. I say there's no shame in that, but I know that people do feel that. And I know that when you're doing the right thing and taking care of yourself and maybe seeking out some kind of counseling, that sometimes that comes back to bite you in the butt, because when you apply for jobs, it all becomes sort of public record. This happened to someone I know years ago that was applying for the Peace Corps and had sought out some psychological or psychiatric counseling during some tough times, and came back to bite them in the butt when they were putting an application into the Peace Corps or one of those organizations. And I'm thinking, how wrong that was, because that was someone taking care of themselves, not hiding under the bed and hiding under the covers and, you know, staying sick and distressed and anxious, but doing something about it. I mean, that's somebody I'd want taking care of me or my loved one. Go figure. We always have something to learn, don't we? So anyway, apologize about the hat. Early day, it was chilly. I needed the hat, and I didn't want to show you a bunch of hat hair, which is just really flattened against my head. Take care of yourselves. Tune into the Travel Nurse Channel anytime. because we're on Facebook and YouTube, all archived for you whenever you want to tune into anything. The titles will give you a little bit of a hint about what it's about. Might be rates, 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 or it might be jobs, 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 or we talk about all kinds of travel subjects. And today was really about you, and I hope you're doing well. And I'll see you next week. Thanks so much. Stay tuned for a little commercial. I just love it. I hope you do too. Bye-bye.
Travel nursing can bring you to places you've never been before. Tell us your story.